Zoom room where hospital administrator Lillian Posadas is standing by. Good morning, Lillian.
Good morning. Good morning, Guam.
We just got the breaking news here of the island's 39th COVID-related fatality. So I guess we could just start there. What can you tell us?
This is an individual who's been here. Sorry, I'm trying to refresh my memory as far as it's a 66-year-old male individual who was admitted since the 28th of August, and he was on a ventilator and has some multiple morbidities. And he was initially seen at the emergency room of GRMC and then transferred to GMH. And, was on the ventilator. And it's sad to say that, he fought COVID, and we, tried to help him with it, manage his treatment. And unfortunately, his system, his health was just so compromised with the comorbidities that he succumbed to the COVID infection. It just ended his life, and it's very sad. So our condolences and prayers to the family.
Lillian, was he on a ventilator?
Yes, he was.
on a
I guess I
ventilator.
wasn't loud enough to say
Oh,
that he
sorry.
was.
Okay.
I said it earlier. I mentioned it earlier that yes, he was on the ventilator.
Are you able to tell us with the comorbidities? Are you able to tell us if it was diabetes or what it was?
Yeah, I guess it is. One of them is diabetes. Yes.
Yeah, it just seems like there's a lot of people the people that have been passing, they've been in the hospital since last month, 3-4 weeks.
Right.
Yeah. The people that are on, how many people? Well, let's just start with the census for today.
Right. 31. We have 31 in the house. Of the 31, 11 of them are at the ICU level of care. And we have 7 individuals on ventilator.
Out of the 7, how long can you kind of tell us how long, or on average, how long they've been on the ventilator?
So one of them's been here since the 19th of August. And then one on the 29th of August also. So those are the longest who've been here. The 19th and the 29th of August. The others are this month, starting with September 2. Yes, starting with September 2.
I see. Can you give us an update on the repairs that are being done by the Army Corps of Engineers contractor? It's Hanson Phelps, right? Hanson Phelps is the one that's doing the work?
Yes, they're the private contractor that Army Corps is working with to then augment and enhance the electrical circuits in the COVID Care 3 up on 4th floor and COVID Care 4, which is on 3rd floor, so that we can then make sure that individuals who are on hemodialysis treatment, each room will now have that additional electrical source to then plug in the hemodialysis machine and the reverse osmosis process in those rooms. And if they are on ventilator, we can run both of those, all the medical equipment. And so that's where we are right now with the Army Corps of Engineers.
Has their work hampered GMH's abilities or space to accommodate more ICU, more patients that need ICU level of care? I mean,
what was the initial part of the question?
Are you having to move ICU level of care patients to different areas, or do you have the space in other areas of the hospital to move patients who need ICU level of care while these repairs are being done?
Right. We've moved some of them down to the 2nd floor ICU because we do have 12 beds in there that also have the negative air pressure in each room. So we've moved those individuals in there. Right now, the Care 2, which was our initial ICU COVID unit, that can house 4 ICU patients on ventilator. We've cleared that out so that we can have the contractor add in electrical circuits again for hemodialysis, because that area was really initially a special services clinic. We converted it to a COVID ICU care unit, and although we can accommodate individuals on ventilator in there, we couldn't do both ventilator and dialysis machine because the electrical source was just not available. We did not have that capacity. So now the contractor is working to augment, to enhance and add in additional electrical circuits for then the hemodialysis capacity.
How sick are these patients that we have under your care, Lillian, the COVID patients? Because I remember you had said the last batch that was very, very sick.
They're very sick, very sick, with multiple comorbidities. Many of them are still on supplemental oxygen, either high flow or regular nasal cannula at 2 liters or 3 liters. Some of them are on CPAP, continuous positive air pressure, oxygen source, and then 7 of them are on ventilator. So they are pretty sick with respiratory, and they are hypoxic, and that's why they're needing the oxygen, supplemental oxygen.
I know last time we asked you when the island was reopened if you had any comments on that, thoughts on that, and I remember that you had some comments about it. So what are your thoughts this morning as we anticipate in about 3 hours this so-called soft opening of a bunch of different types of businesses?
Right, relaxation of some of the restrictions.
Right.
And so, of course, we're going to anticipate, and we continue to plan and anticipate people coming in, especially those who've tested positive from the previous, results of, 40 some, 30 some. We can anticipate that perhaps 20% of that, number of individuals with positive results may need to come into the hospital, especially if they've got some immunized, they're immune compromised, they've got comorbidities, they've got some respiratory conditions, they may get exacerbated and they may need to be hospitalized if they develop pneumonia and are having a hard time breathing and they're not getting adequate oxygenation. We're going to anticipate that they come in. And so hopefully that they don't, and that they, continue to heal and recover from it, keeping themselves isolated, and they manage it. Hopefully that's the goal, is that they manage their condition and they monitor their symptoms, and so that they continue to heal and recover from it, so they don't need to come into the hospital. But although they need to, they're having some respiratory symptoms, they're feeling that they're not getting enough oxygen into their system, then definitely they need to get medical attention. So we're anticipating that they will come in. They may come in.
Right.
In anticipation that more patients might need ICU level of care, and you've got these renovations underway, are you working with GRMC, I guess, to provide that extra support in case you needed to provide that ICU level of care in the event that you run out of space?
What was the question, initial part of the question? Are we working with who?
Guam Regional Medical City.
Oh,
Because
yes,
you've
of
got
course.
renovations underway, and so you're kind of shifting people around, patients that might need ICU level of care. But as we reopen, and in anticipation that who knows what might happen, what's in place with GRMC to be able to handle the extra load of patients that might need ICU level of care?
Right. We've assigned some of our nurses, medical surgical nurses over to GRMC to handle non-COVID patients. And so we continue to try and decompress our non-COVID inpatient units. And so that way we can have an additional 67 beds if we need to accommodate COVID patients. Right now we have 66 bed here in the acute site if we need, if there is another surge of COVID patients. And then we also have the SIF, 54 beds. And if we do decompress the surgical telemetry units, so that's an additional, I believe, 67 beds that we can then open up for COVID. And so, we do have the bed capacity. Hopefully that we don't have 400 individuals needing to come into the hospital. So, that's when we're going to really need to, work with the government and in terms of getting that blue tent, the blue medical tent, if we need to. But hopefully we won't. So we'll
thought
deal
that
with
was
what
ordered.
we've got right now. What was that?
I thought that was ordered, the blue med tents.
Right, it is ordered, but we haven't yet seen the final official that it is ready to be, resurrected if we need to in our parking lot. So, but then again, that's going to need staffing also. So, that's the other challenge. But we do have the additional resources, specialized and experienced nurses they are experienced with COVID. And so we now have them on board because we are, going to be losing the DOD EMAC, hopefully in a gradual phase out process. But we have to also be prepared for that. And, we lost 20 of our own registered nurses. From the time we started having these COVID patients in here, we lost 20 nurses, staff nurses, from March to this month. We lost through a resignation. They don't want to work here. They don't want to be in this COVID environment. And some of them also took the option of retiring. So, imagine we lost 20 nurses. We also had 28 nurses who had COVID infection. So, we were really down 48 nurses. And so that's why we needed to have this infusion of, additional staffing resources, especially those who have ICU, emergency room, hemodialysis, and telemetry experience, and in a COVID environment, in a COVID hospital.
So how concerned are you come next week when the DOD team of nurses leaves? Because it sounds like you're still going to be down.
Right. We are concerned, absolutely, and that's why we've requested for an extension. And so we're just waiting now for the official decision of FEMA and DOD and HHS if that's going to be approved.
Can I just ask you a couple ops questions we had in the comments here? One on visiting. Is it going to be allowed now that we're in PCOR 1 light? And also the business office. People writing, I need to pay my bill before they garnish my tax.
They can come in and pay their bills. We have accommodated people, and they do. We also have the online mechanism for people to pay their bills. But yes, we have, they certainly can come in to pay their bills. And, we do have a process, and we do have, in place to keep the social distancing. We have the plexiglass. So there's, minimizing the transmission, on face-to-face service. So people can still come in and do pay their bills. But in terms of visitation, we haven't yet made a decision to, lift some of those restrictions. We continue to accommodate the requests of patients, both COVID and non-COVID, if they need or if they would like spiritual services. We work with the Catholic, with the Archdiocese, and also and other religious, services that are available. They're welcome, but they just need to communicate that with our nurse management units and the doctors, the physicians. So, but as far as allowing the visitation, we're going to revisit that to see how we can accommodate the families to see their loved ones, and so, and part of the restrictions of the that's been sent out by the executive order, the governor's executive order, is still no congregation in waiting areas. So we're going to need to try and make sure we enforce that.
Lillian, what happens if the feds don't grant this gradual extension of this medical team?
Okay. Well, I mean, it will be great. It will be to our advantage, to the advantage of the patients, because then it allows us to then make sure that we have a safe and a smooth transition between the DOD nurses and the staffing solution nurses that are now on board and are on boots on the ground, because they're going to, get oriented to the unit. They're going to need to get acclimated to our electronic health record system, our policies, and how we do things here in this organization. So it's going to be really beneficial, helpful that we have that safe and smooth transition handing off.
Right, but what if they say no to our request?
Well, then we just have to deal with who we have right now with this staffing solution company and our own staff nurses here. And there is another travel nurse company that we have an agreement with since 2018. We've also requested from them to send us some nurses with the specialties of ICU and hemodialysis. So that's an ongoing communication and request that we've asked this other staffing solution agency.
I see. Is there any other work that needs to be done to the Guam Memorial Hospital that you foresee us making a request to FEMA or the U.S. Army Corps of Engineers? Because I know we had Dr. Jolene Uggan on, and she was talking about the leaks in the roofs. Is there anything else on the table?
What we have requested when we've met with the DOD authorities is that some medical equipment that we would need. We're working on getting our Wi-Fi capacity enhancement. The telemedicine, we have asked to help us with that one so that they can enhance, and so that the physicians don't have to constantly go in and out of the patient rooms. They can see the patient through that telemedicine capacity and do their assessment, communication with the patient, and so those are the three items that we have asked DOD to help us with. The leak, the roof leak, that's something that we've already started to work on, and so we just need to continue pushing that along. That we need to get the roof leaking roof repaired.
Well, how soon are we going to see that repaired?
We'd like to see it since last month, several months ago, but given all the other things that are happening, but we are pushing it.
Any other structural repairs that need to be done and that will be done?
Well, in the operating room, I think we need to get that HVAC. That's something that we need to continue working on for now. I can't remember all the other structural issues. So, right, we're moving along with getting the comm center, the Z wing, the dilapidated, condemned Z wing right at the front. We need to move out the comm center that's in that corner and clear out the medical records that are in there stored, so that we can then get that Z wing demolished.
Okay.
All right.
Yes. Thank you, Lillian.
Okay.
Well, have a good
You take
weekend.
care.
Yeah. When are we getting our tattoo?
When are we gonna what?
Are we getting our tattoo or what?
Tattoo? What are we gonna tattoo?
I don't know.
I'm not into tattooing.
I haven't. I never got one yet, so I figured, but now I can get one. So
Okay.
I'll let you know.
All righty.
That's
Take care.
Have a good weekend.
Be
Be
safe.
safe. Okay.
All
Bye.
right.